Opioid advice for doctors and healthcare professionals. Agenda: what is overprescribing? History of overprescribing, patient-centered approach to treatment, and opioid alternatives. This information was provided by the Centers for Disease Control. So what is overprescribing? Overprescription is prescribing more medication than what is actually needed. More than 80% of all opioid prescriptions are written by doctors in the US. 65% of heroin users report that they use prescription opioids first and then made the switch to heroin. Example of overprescription. New York doctor was recently charged with 5 counts of murder for overprescription. The Nassau County District Attorney described him as a serial killer who had knowingly prescribed huge amounts of painkillers to his patients, many of whom were already addicted to opioids or other drugs. If you are a healthcare professional, consider taking the patient-centered approach to treatment. Ask open-ended questions. For example, you might say, "Tell me about how your pain is currently affecting your life." Pay attention to implicit bias. Black Americans are systematically undertreated for pain relative to white Americans. Prior research suggests that if the patient is Black, then his pain will likely be underestimated and undertreated, leading to doctors overprescribing white patients and underprescribing Black patients. The implicit association test developed by researchers at Harvard defined your own implicit bias. Ways to combat implicit bias. Mindfulness. Since you're more likely to give in to your biases when you're under pressure, practice ways to reduce stress and increase mindfulness. Perspective taking. Consider experiences from the point of view of the person being treated. You can do this by reading or watching content that discusses those experiences. Learn to slow down. Before interacting with people from certain groups, pause and reflect to reduce reflexive actions. Individualization. Evaluate people based on their personal characteristics rather than those affiliated with their group. Set reasonable goals. Talk with your patient and find out what they want to be with regards to pain control. Use reflective listening. Be an active listener when it comes to your patient's concerns. Maintain eye contact and use appropriate nonverbal ways of communicating. Discuss treatment options. Consider non-opioid medications and non-pharmacological treatment options with the patient. Empathize and show compassion. Show compassion in that you are genuinely interested in helping and collaborating with the patient to find a solution. There is a good correlation between physician empathy and patient satisfaction, and a direct positive relationship with strengthening patient enablement. Empathy lowers patients' anxiety and distress and delivers significantly better clinical outcomes. Adjust to client resistance. Argument and direct confrontation can reinforce a defensive oppositional stance. Recognize patient resistance as a signal to listen more carefully. Employ change talk. Listen carefully for indications the patient is considering change. Reinforce and encourage these thoughts with credible, clear, and actionable information. Non-opioid medication options. Analgesics. There's acetaminophen, such as Tylenol, and selective COX-2 inhibitors and NSAIDs, like ibuprofen. Non-pharmacological options are exercise therapy and cognitive behavioral therapy. Thank you for watching. For more information, contact Marilyn Rhoda at umd.edu or visit our website at marilynrhoda.org.